You feel constantly exhausted, your ankles are slightly swollen by the end of the day, and you assume it is just from working too hard. But then you look in the toilet bowl and notice your urine looks unusually foamy. What if I told you that your exhaustion isn't from a lack of sleep, but from a silent filter in your body that is slowly failing? Today, we are exposing. This video is strictly for educational purposes only. Chronic kidney disease is a serious medical condition. Always consult your nephrologist or registered dietitian before changing your diet or lifestyle. The information provided here is to help you manage your kidney health and slow disease progression, not to cure it. Never stop your prescribed medications. If you are listening to this and thinking, "That sounds exactly like me," I want you to pause for a second and breathe. You are not lazy. You are not imagining it. And you are definitely not just getting older. Chronic kidney disease can be incredibly quiet in its early stages, and many people have few or no symptoms until the disease is already more advanced. That is what makes kidney disease so dangerous. It can progress without screaming for attention. Your kidneys work every minute of every day to filter waste, balance fluids, and regulate minerals. But the inside of the kidney is not designed to give you the kind of sharp pain people expect from an injury. In fact, kidney pain is usually associated with things like stretching of the kidney covering, blockage, or infection, not the slow, silent loss of filtering function that happens in CKD. That is why someone can feel tired, foggy, puffy, or off for months and never realize their kidneys are struggling. The body does not always wave a red flag early. Sometimes it whispers. Sometimes it whispers through fatigue. Sometimes it whispers through swelling. Sometimes it whispers through the urine. And if you learn how to listen now, you can catch the problem earlier and protect the kidney function you still have. Early CKD may have no symptoms, and swelling can appear when the kidneys can no longer remove extra fluid and salt effectively. I want to be very clear. Hearing this is not a reason to panic. It is a reason to pay attention. Kidney disease is serious, but seriousness is exactly why early awareness matters. When you know what to look for, you can bring better questions to your clinician, ask for the right tests, and make better daily choices that support your kidneys instead of overloading them. So in this masterclass, we are going to strip away the confusion and look at the signs that too many people ignore. We will talk about what your urine may be telling you, why swelling matters, and why fatigue is sometimes more than just fatigue. Stay with me, because the earlier you understand the warning signs, the better chance you have to support your kidneys and preserve function. Now let's get practical. The problem with early kidney disease is not that it is always dramatic. The problem is that it is often subtle. Some of the first clues are easy to dismiss as stress, age, dehydration, or just a bad week. But when these clues keep repeating, they deserve attention. These are the quiet signals I want you to watch for. First, foamy urine. This is one of the most important visual clues because it can point to protein in the urine. Healthy kidneys act like tiny filters that keep valuable proteins in the blood while removing waste. When those filters are damaged, protein can leak into the urine, and that extra protein can make the urine look bubbly or foamy. It is not proof of kidney disease by itself, but if the foam shows up often, it should be discussed with a clinician. Second, swollen ankles or feet. This is another classic warning sign. When the kidneys struggle, they can have a harder time balancing sodium and fluid, and that extra fluid tends to settle in the lowest parts of the body. That is why the ankles, feet, and lower legs often look puffy by the end of the day. Swelling can have many causes, but in the setting of kidney disease, It is a sign that fluid handling may be going off track. Third, severe itching, also called uremic pruritus or CKD-associated pruritus. This is not the same as a simple dry skin itch. In kidney disease, itching can become intense, persistent, and hard to ignore, especially as waste products and mineral imbalances build up in the body. Researchers describe uremic pruritus as a common and often debilitating symptom in CKD, and it can seriously affect sleep and quality of life. If someone keeps scratching without relief, kidney disease is one of the possibilities that should be checked. Fourth, a metallic taste or ammonia-like breath. When waste products such as urea build up in the blood, people can notice that food tastes strange, metallic, or bitter, and breath may develop an ammonia-like or urine-like odor. That symptom belongs in the same warning category as nausea, loss of appetite, or feeling unwell for no obvious reason. It is one more sign that the body is carrying wastes it was supposed to clear. Here is the key message. These symptoms do not always show up all at once, and they do not always appear early. But when they do appear together, or keep returning, they deserve a real kidney workup instead of a guess. Foamy urine, swelling, intense itching, and a metallic taste are not things to brush off as normal aging. They are your body asking you to pay attention before the damage becomes harder to ignore. Now let's demystify the lab report, because for many people this is the moment everything starts to make sense. The kidney numbers may look intimidating at first, but they are really telling a simple story. How hard your kidneys are filtering, how much waste is building up, and whether damage may be progressing. Doctors commonly use blood and urine tests such as creatinine, BUN, and eGFR to evaluate kidney function. First, creatinine. Creatinine is a waste product made by your muscles, and healthy kidneys normally clear it from the blood. When creatinine rises, it can be a sign that the kidneys are not filtering as efficiently as they should. But creatinine by itself is not the whole story, because it is influenced by muscle mass, age, sex, and other factors. That is why clinicians do not look at it in isolation. They use it as part of the bigger kidney picture. Second, BUN or blood urea nitrogen. BUN measures the amount of urea nitrogen in your blood, which is a waste product created when the body breaks down protein. The kidneys normally remove it. When BUN is elevated, it can suggest the kidneys are not clearing waste well, but it can also be affected by dehydration, diet, liver issues, and other conditions. In many labs, a typical BUN range is about 6 to 20 or 7 to 20 milligrams per deciliter, but the exact reference range depends on the lab. Third, eGFR, the number I want you to remember most. eGFR stands for estimated glomerular filtration rate, and it is the closest thing to a kidney performance score on a routine blood test. It is calculated from creatinine and other factors such as age and sex, and it helps show how well the kidneys are filtering. In general, an eGFR of 90 or higher is considered normal. 60 to 89 may suggest early kidney disease or reduced kidney reserve depending on the full picture. Below 60 is a major warning sign, and 15 or below is kidney failure territory. Doctors also use persistence over time, because one single test is not the whole diagnosis. So when you hear a clinician say, "Your creatinine is up," or "Your eGFR is down," what they are really saying is this: the filter is under stress, and the goal is to protect the function that is still left. This is why lab work matters so much in CKD. It turns vague fatigue into something measurable, and measurable means actionable. It gives you a chance to slow the decline, not wait for a crisis. Now we get to the part that actually changes the trajectory. Here is the hard truth. When kidney function is lost, the goal is not to pretend nothing happened. The goal is to protect what is still working. Kidney disease progresses faster when blood pressure and blood sugar are left uncontrolled, which is why those two numbers matter so much. In chronic kidney disease, the kidneys can no longer filter blood the way they should, and treatment focuses on slowing progression and reducing complications. That is why I want you to think in terms of protection, not panic. You cannot simply will damaged kidney tissue back into existence with a supplement or a trend. CKD is associated with kidney damage and scarring, and the clinical focus is to delay progression and prevent complications. The most effective day-to-day strategy is to bring the workload down on the kidneys by controlling blood pressure, controlling blood glucose when diabetes is present, and taking prescribed medicines exactly as directed. ACE inhibitors and ARBs are commonly used because they may slow kidney disease progression. And this is where diet becomes your primary weapon. But kidney diet is not simple, and that is exactly why people get overwhelmed. The right plan may need to balance sodium, potassium, phosphorus, calcium, protein, calories, and fluid depending on your stage, your lab results, and whether you have diabetes or high blood pressure. That is why kidney organizations strongly recommend working with a registered dietitian or kidney dietitian whenever possible, because the food plan has to match the blood work, not guesswork. So when you hear about a comprehensive renal diet and lifestyle blueprint, this is what it should mean. Step-by-step guidance, practical meal structure, food swaps, recipes, medication reminders, and daily habits that reduce kidney workload and help preserve function. The point is not to flood you with rules. The point is to give you a system you can actually follow, so your kidneys are not carrying more than they should. Lower sodium intake, individual nutrient planning, and ongoing support are central parts of that approach. As we close, I want you to hold on to one truth. Your kidneys may be working in silence, but they are working for you every second of every day. And in chronic kidney disease, silence is part of the danger. Early CKD may have no symptoms, and even in stage 3, many people still do not feel dramatic kidney pain. That is why tiredness, swelling, foamy urine, itching, or a strange taste should never be dismissed too quickly. The earlier you notice the pattern, the more opportunity you have to protect the kidney function that remains. This is the moment to stop guessing and start measuring. If your body has been sending signals, bring those concerns to a clinician and ask what your creatinine, BUN, eGFR, and urine albumin results really mean in your case. Kidney specialists use those measurements because they help show how well the kidneys are filtering and whether kidney damage is present. If swelling is part of your story, remember that edema can happen when the kidneys cannot remove extra fluid and salt effectively. And if you need a practical next step, this is where a structured renal eating plan can help. Kidney nutrition is not one size fits all, because the right plan may need to balance sodium, potassium, phosphorus, protein, calories, and fluid depending on your labs and stage. That is why the National Institute of Diabetes and Digestive and Kidney Diseases recommends working with a registered dietitian if possible, especially as CKD advances and nutritional needs change. So here is the final message I want you to remember. Do not ignore the signs in the toilet, do not brush off the swelling, and do not treat fatigue like it is always just life. Protect your filters, work with your healthcare team, and make the choices that help preserve kidney function for as long as possible. If you want a step-by-step renal diet and lifestyle blueprint, check the link in the description. And one last reminder. This video is for education only, not a substitute for medical care. Chronic kidney disease should be managed with your nephrologist or registered dietitian, and you should never stop prescribed medications without their guidance.